Hello everyone, my name is Sentimongla Tzudir, and today I will be sharing a little bit on HIV and AIDS and STI and RTI. So what does HIV stand for? HIV, it stands for Human Immunodeficiency Virus. We have all heard of HIV as such, but do we really understand the in-depth nature of how the virus acts and how the routes of transmission are, and how can we prevent ourselves from getting HIV. So today I will be sharing a little bit on how HIV is spread and all the details included in that. So HIV, as we know, it stands for Human Immunodeficiency Virus, and the HIV virus, it lives in the blood and it affects our immune system. The immune system helps us to fight diseases. So when our immune system is affected, then our immune system, when our immune system is low, then we are unable to fight the diseases as well. So HIV invades and breaks down our immune system, especially the CD4 cells. CD4 cells are those cells which help our body fight diseases. And when the virus enters the CD4 cells, then the virus rapidly spreads inside our body, and that is when we are infected with the virus. So when a person is infected with HIV, it lowers our immune system, and we fall, and when a person is HIV positive, a person falls ill frequently and is always feeling weak as well. Now, what is AIDS? AIDS is acquired immune deficiency syndrome. When we talk of HIV and AIDS, we sometimes get confused whether it's the same thing or is it different, or how is it. So when we are talking of HIV and AIDS, it refers to the same thing, okay? But HIV, Human Immunodeficiency Virus, it refers to the virus, whereas AIDS, Acquired Immune Deficiency Syndrome, it refers to the later part of the HIV infection, where a person is infected with HIV and his or her immune system becomes low, and his immune system is severely damaged, and he has difficulty fighting diseases as well. So this is the difference. Now, I repeat, HIV and AIDS, it refers to the same term, okay? But HIV virus is the name of the virus itself, and AIDS is the late stage part of the HIV disease. So this is the difference between HIV and AIDS. Now, how is HIV transmitted? We have lots of myths and misconceptions where we are not able to say the right route of transmission of the disease. So how is HIV transmitted? Please note there are only 4 routes of transmission of HIV. Now, the first thing, unprotected sex with an infected person. Infected person means a person who is HIV infected. Secondly, sharing of infected blood and blood products. Thirdly, sharing of infected needles and syringe. And fourthly, from an infected mother to her child. Okay, so we have 4 routes of transmission: having unprotected sex with an HIV infected person, from infected blood and blood products, from infected needle and syringe, and from an infected mother to her baby. So there are just 4 routes of transmission. Now, how is HIV not transmitted? HIV is not transmitted by shaking or hugging an HIV infected person. HIV is not transmitted by air, coughing or sneezing. HIV is not transmitted by sharing of utensils, cups, plates and dishes. HIV is not transmitted by sharing of toilets. HIV is not transmitted by sharing of clothes, okay? And HIV is definitely not spread by mosquito bites or fleas or insects. Please keep that in mind. So I repeat, we have just 4 routes of transmission of HIV, okay? And so, how will you know whether you have HIV or not? You can't know for sure whether a person has HIV or not just by looking at a person. HIV you will know your HIV status only when you are tested for HIV. A simple blood test which you can get done at a government health facility, at government hospitals, okay, and it's free of cost. Before HIV test is voluntary. HIV test, before you get your HIV testing done, a counselor will be there to counsel you. And please note that the report of the HIV is completely confidential. So your HIV status will remain confidential to you and the counselor only. So please get your HIV status known by going to a government hospital where we have centers called Integrated Counseling and Testing Centers, ICTCs, where the HIV testing is done free of cost. So how can you prevent yourself from getting HIV? We usually talk of the ABCs of prevention of HIV. So A stands for abstinence, okay? Abstinence from sexual activities until marriage. B is being faithful to your partner, and C is the correct and consistent use of condoms. So please note A, B, and C of prevention of HIV. Abstinence, being faithful to your partner, and C, correct and consistent use of condoms. We mostly encourage abstinence, where you wait to have sex until you are married. So A comes first always. Even in the alphabet, A comes first. Even for HIV prevention, A comes first. Further, you can also prevent from getting HIV by making sure that you're using fresh needles and syringes whenever you are whenever you're getting injected, okay? And also making sure that whenever you are in need of blood or blood products, you contact a registered or recognized blood bank. Also, you can prevent mother-to-child transmission of HIV by the prevention of parent-to-child transmission, PPTCT program, which is also available at the government hospitals. So the most important question now remains, can HIV and AIDS be cured? No. As of now, there is no cure for HIV and AIDS, but we have treatment available which can help a person living with HIV to live a prolonged and healthy and quality life. So what is this treatment for HIV positive person? This treatment is called antiretroviral therapy. It's ART. It is available at ART centers, okay? And these medicines are available free of cost. So what is ART? Antiretroviral treatment or therapy is a combination of drugs which is given to HIV positive patients who come to the centers. So when a person is tested HIV positive, he or she needs to be registered at an ART center. And from there on, they will be monitored by an authorized medical doctor, and the doctor will give the ART medicines to this HIV positive person. Now, what does ART medicine do? The ART medicine, it helps in the suppression of the virus inside your body, okay? And when the virus is suppressed inside your body, then your body automatically becomes healthy, and you live a prolonged and quality life. So, and also this ART medicine, it reduces the risk of HIV transmission as well. And it helps prevent the spread of the virus to a later stage, that is, it prevents from the HIV to proceed or go further to the last stage of the disease, that is AIDS. So that is what the medicine does. And it also protects the immune system of a person infected with HIV, and it helps in the person living a very healthy, prolonged life as well. And now, we need to be aware that we also know that HIV has no cure as of now, but treatment is available, and this treatment is a lifelong drug. You can't leave your medicines halfway or half done, or you can't keep skipping your medicines. It is an everyday drug which will be monitored by the ART team, and this medicine will be taken lifelong. So ART is a lifelong drug. Now let's talk about STIs, sexually transmitted infections. So what are STIs? STIs are primarily transmitted from one person to another through sexual contact. So this is what STIs are. STIs are what STIs are all about. Sexually transmitted infections. It is transmitted from one person to another primarily through sexual contact. So what are the signs and symptoms of STI in our body? We have genital sores or ulcers. We have burning sensation while you pass your urine. There can be discharge, vaginal discharge as well, discharge from the penis. Also, we have itching of the groin area. We have lower abdomen pain and change in menstrual flow as well. So these are some of the signs and symptoms of STI. So what are the issues related to STI? STI increases the risk of getting HIV infection. STIs also causes infertility among men and women, and complications in pregnancy as well, which can lead to miscarriage, stillbirth, or defects in infants as well. And also, if untreated, the STIs can also cause major health problems, which can lead to chronic ill health and disabilities, and even increase your risk of getting cancer as well. So these are some of the issues related to STI. So now, how can you protect yourself from getting STI? First and foremost, avoid multiple sexual partners. Abstain from promiscuity. Remember that your partner can be infected with STI but still look normal, okay? And also, use of condoms. Condoms are the only barrier which will help provide a barrier between your body fluids and an STI infection as well. Wash with soap and water after sexual intercourse, and avoid high-risk behaviors. Abstain from high-risk behavioral habits as well. So these are the ways on how you can protect yourselves from sexually transmitted infections. Now, if you have any of these signs and symptoms which I had shared with you earlier, seek medical help immediately without any delay. Visit the nearest STI-RTI clinic and consult the doctor immediately. You can also get tested and get free medication from any government hospitals or Suraksha clinics. So these are the ways to protect yourselves from STI, as well as if you have any signs and symptoms, then you can immediately seek medical help as well. That's all for today. These are some of the important points for HIV and AIDS and sexually transmitted infections. I repeat, HIV stands for human immunodeficiency virus, AIDS stands for acquired immune deficiency syndrome, and STI, sexually transmitted infections. 4 routes of HIV transmission, and the ABCs of prevention. First and foremost, abstinence. Okay, we have A, first and foremost. When you are following abstinence, it will prevent you from both HIV transmission as well as sexually transmitted infections as well. For more detailed information on HIV and AIDS, you can call 1097, which is the toll-free number. Also, we have a NACO app, NACO app, which you can download from the Play Store as well. So those are the ways where you can get further information on HIV and AIDS. Thank you so much for listening in and have a good day.